Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. Thank you for joining us today for part 2 of a 2-part special edition of RegWatch, featuring our interview with Jeffrey Weiss, former Chief Engagement Officer at NJOY. Jeff, thanks for continuing our conversation.
Thanks so much for having me. I appreciate it.
A note to our viewers, please go to RegulatorWatch.com to find part 1 of this interview, where Jeffrey and I talk in detail about the FDA's recent authorization of NJOY's menthol-flavored e-cigarette products. Jeffrey, as we did in part 1, I should point out that your tenure at NJOY was significant and consequential. You served as a board member, as general counsel, and during the tumultuous years as interim president at NJOY. Let's start at the beginning. When was NJOY founded and by who?
The company was founded originally in 2006 by one of my brothers, Mark Weiss. So he set it up in 2006. Company sold its first product in, I can't remember if it was late 2006, early 2007. So one of the very, very first companies into the marketplace. And I think first really began to make news when it was caught up in FDA's attempt to essentially ban the technology back in the 2008-2009 timeframe by seizing products as they came into the country and banning them as unapproved drug delivery devices. And that led to a landmark lawsuit that we filed against the FDA to deal with that.
Well, let's talk about that right off the bat, because it is such a big deal and it was kind of foundational for the industry. This is the Sotera versus FDA lawsuit. Fill us in on that.
Sure. And Sotera was the legal name of the company. So if you look at the caption of the lawsuit, it's Sotera DBA NJOY Incorporated. And so basically the products were being seized as unapproved drug delivery devices. And we filed a motion for a preliminary injunction to stop those seizures and argued that these were not drug delivery devices absent claims that they would help a smoker quit smoking, which the medicinal definition of smoking cessation is not just quitting smoking, it's also quitting all use of nicotine. And so unless we were making therapeutic claims for the product, FDA could not regulate them as drug delivery devices. While the lawsuit was pending, the Tobacco Control Act was passed, and we were called upon to brief its potential impact on the case. And so basically had to make a decision. Do we go sort of all or nothing? Our only argument is that these are unapproved drug delivery devices. And if the court disagrees, there's no industry because we didn't have an approval and nobody did, and nobody was going to get one anytime soon. Or do we argue that these can be regulated by FDA, not as medicinal products, unless there are claims, but could regulate them as tobacco products under the new statute because the nicotine in the products was derived from the tobacco plant itself, and therefore it fit the definition of a tobacco product. And we elected to go that route for a variety of reasons, including that I think we felt even then that eventually it was going to be important that the category be subject to responsible FDA regulation, proportionate FDA regulation, that would help engender confidence in the technology on the part of adult smokers, on the part of healthcare practitioners, on the part of the public generally. And so, that was the thinking. At that time, we won the case at the district court level. FDA appealed to the DC Circuit. We won there as well, in front of an interesting panel that included both Brett Kavanaugh and Merrick Garland. And FDA decided not to seek Supreme Court review and instead announced its intention to issue a deeming rule and to bring the category under full FDA jurisdiction under the Tobacco Control Act.
Now, from the moment that happened, in 2016, that was just right around when we started covering this issue. And I was very frustrated when I learned that one of the top pioneering e-cigarette companies in court fought the battle to get, vaping deemed as a tobacco product, when being deemed as a tobacco product was exactly what gave FDA the power to destroy the industry. And maybe they weren't going to destroy it in 2016, but very quickly became clear they were going to destroy it, and they are destroying it.
Well, it's interesting. I think, we won that court case back in 2011. The deeming rule was actually not finalized until 2016, so not for an additional 5 years. And certainly, I think there was a lot of cause for optimism during most of that period, because Mitch Zeller was CTP director, I believe, beginning in 2013, had a record of being a strong proponent of tobacco harm reduction. He initiated the Institute of Medicine's landmark 2001 report on tobacco harm reduction. He led or co-led the 2005 to 2009 strategic dialogue on tobacco harm reduction. And so, I think we had a lot of reason to believe that the category and the whole concept of tobacco harm reduction was in good hands, responsible hands, and that there would be a rapid issuance of a deeming rule, and there would be proportionate regulation of the category, and we'd get to a place where we had good authorized products that people had confidence in, and we would see, really just a complete transformation in how nicotine was consumed in this country. But of course, events played out somewhat differently than that.
So let's pull everything back then, again, to those early NJOY days. Was your brother Mark a smoker?
No, I come from a family of mostly lawyers, both parents, and I'm one of 7 children, including 5 boys, and 4 of the 5 boys are attorneys. And us 4 brothers all at one time practiced with our father, who was a patent attorney, and eventually 3 of us also became patent attorneys. And so for us, I think we looked at it in the way that a patent attorney looks at an invention, as an improvement over existing technology. So if the existing technology for delivering nicotine through inhalation is a combustion cigarette that kills between 1/2 and 2/3 of longtime users when used as intended, an improvement is a product that delivers nicotine through inhalation in a satisfying way without causing the same amount of death and disease as measured by things like emissions, harmful and potentially harmful constituents. So we at this point know with great specificity what is it in a combustion cigarette that causes all of the harms that we see. Things like carbon monoxide, tobacco-specific nitrosamines, volatile organic compounds. We can measure those things. We can measure them in cigarette smoke, and we can measure them in the emissions from an e-cigarette. So I think to Mark and later to me, to Craig, to us, it all made sense just as patent attorneys. This is a tremendous example of technology coming along to potentially solve what had seemed to be an intractable problem.
I think it's interesting, you're all from the same family. It's a bit of a family-run business, and I didn't know that at the time. It's very cool. How quickly did NJOY meet with success?
NJOY was starting to get traction, was starting to get good distribution of its products when the FDA seizures began in 2008. Basically, after the FDA case was concluded successfully, I think that's when NJOY really took off, and that's when it really became a nationally distributed brand, started to appear in the majority of the top 10 retail chains in the country, was being distributed by the largest distributors to convenience stores in the country. 2012, 2013, first with its NJOY disposable, and then with its NJOY King disposable. Those were each in their time #1 products in the marketplace. We had those TV commercials, that substantial market share. So, those were really the glory early days of the company.
Let's take a look at a couple of the commercials. There's an interesting kind of lifestyle one that ends on a wedding, and then there is a curious Courtney Love one too. Let's take a listen.
You know what the most amazing thing about this cigarette is? It isn't one. Introducing the NJOY King, the first electronic cigarette with the look, feel, and flavor of the real thing. Finally, smokers have a real alternative. New NJOY King. For cigarettes, you've met your match.
So the first one was, so I should step back and kind of explain the company's thinking at the time, which in hindsight, I think we got a lot of things right, and we got a number of things wrong. it was our view, back in those early days, and I think of a lot of the marketplace, that the way to solve this problem would be to replicate as accurately as possible the combustion cigarette in an electronic form. So it should look like it, it should taste like it should function like it, and the king size of combustion cigarette is the dominant combustion cigarette sold in the marketplace. So our goal became to replicate very specifically the king size, to have basically the same length, the same diameter, as closely as possible the same weight, and as closely as possible the same feel. And so we had, for example, a paper covering over most of it. It was a kind of a deformable plastic tube, so you could squeeze it. The user could squeeze it when they were using it. When it was in their mouth, it kind of deformed in the way that a real cigarette would conform. Even the light actually appeared to sort of burn down the length of the cigarette as a user inhaled. So, we worked very, very hard on that. And so the first commercial with the Foreigner song, "Feels Like the First Time," really was intended to convey, like, wow, this is amazing. Like, this is just like a cigarette. And our goal was, and the phrasing that we used to use internally was, we wanted a short bridge to familiarity. We wanted to make it, as though a smoker were changing brands, that it would be just a simple thing to go from Camel, Newport, Marlboro, whatever the brand might be, to an NJOY King product, which was in both tobacco and menthol flavors.
Hey, brother, there's an endless road to rediscover. For you, there's nothing in this world I wouldn't do.
For everything friends do for each other, return the favor. Give a friend an NJOY King electronic cigarette, made to satisfy.
I think the second commercial, "Friends Don't Let Friends Smoke," was, basically trying to show not so much lifestyle, but, basically that if you care about a loved one who smokes, you should maybe help them try to make a switch from cigarettes to a vapor product, or to the NJOY, in particular the NJOY King vapor product.
Excuse me? You can't smoke in here.
Relax. It's a fucking NJOY.
And then I think the Courtney Love YouTube video, I think also was in this theme, more like the first commercial, of just, isn't it amazing how lifelike it is, how realistic looking it is? In hindsight, I think, much later we kind of realized, wait a minute, if the product looks that much like a cigarette, you're actually depriving a switcher, a would-be switcher, of one of the great benefits of switching, which is to no longer not just be not smoking a cigarette, but to not be seen as smoking a cigarette. And someone who used one of our NJOY King products actually looked like they were smoking a cigarette, as is demonstrated in the Courtney Love YouTube video. So, but yeah, so that was kind of the thinking at the time, in hindsight.
So Cigalite wasn't the right form factor.
Correct. I think Cigalite was not the right form factor. It was not the right fit for a variety of reasons. I think we realized over time smokers don't want to be seen as smoking. I think we realized over time that flavor satisfaction plays a very important role. And just because cigarettes come only in tobacco and menthol flavors doesn't mean that those are the only flavors that a smoker would want to use. And in fact, giving them a non-traditional flavor that distances them more effectively from their cigarette flavor makes them less likely to return to cigarette smoking, and can be kind of an enhancement, an additional positive reason to switch. Well, this tastes better, and which of course is what if you've ever talked to switchers, who've gone on to use flavored products, that's invariably what will be part of what you hear from them, which is, this tastes so much better than my cigarette. I would never go back to that smoky, harsh, kind of dirty taste that I was so accustomed to. This is a much better experience. So, over time we figured a lot of that stuff out, but in the early days, we thought about it differently.
Was there a stampede of customers banging down NJOY's door to, for Cigalites to quit smoking?
There were. I mean, we had well over 40% market share. I think there had a tobacco control person once explained to me years ago. He was telling me about when the nicotine patch first came out, and he was like, stores couldn't keep them on shelves. Like, pharmacies couldn't keep them on shelves. There was such pent up demand that, smokers, I think according to CDC data, 69-70% of smokers want to quit or reduce. And so there's always this pent up demand for smokers to be able to make a change. But of course, quitting is notoriously difficult. The existing medicinal products have not solved the problem. And so when something new comes along, that's where you see that pent up demand get expressed. And, back in the day, pharmaceutical companies experienced it with the patch, even though the patch really wasn't very effective. And the early e-cigarette companies like NJOY that were nationally distributed, we experienced it as well, because smokers were excited that, hey, maybe this could be the thing that finally gets me off of cigarettes. So definitely, I think early days seemed to very much validate the conception that we had.
Suppose somebody invented a device that could make tobacco obsolete, a product that could give smokers the same nicotine kick as a cigarette, but without all the carcinogenic smoke, tar, and carbon monoxide. Wouldn't that product be just flying off the shelves, and wouldn't it be a public health miracle? Of course, I'm talking about electronic cigarettes. They've become incredibly controversial within the public health community. Tonight, we're going off the tape to get a better sense of what's happening in this rapidly expanding industry with the help of NJOY, a privately held company that controls 40% of the market for e-cigarettes in the United States. This is a $1 billion market in the United States. This is a $3 billion market worldwide. And it's been growing at a 100% clip for the last 3 years. Lorillard, which you probably know as the maker of Newports, has been getting a huge boost from their e-cigarette business, and Philip Morris plans to get into the game next year. In October, 40 state attorney generals sent the FDA a letter pushing for electronic cigarettes to be treated like tobacco products for regulatory purposes. And while most states don't currently target e-cigarettes with specific taxes, Minnesota slapped a 95% tax on them last year, which effectively makes electronic cigarettes more expensive than real ones. That can't be good policy, can it? Which brings me back to NJOY, the maker of NJOY Kings, the most electronic cigarettes with the most traditional cigarette look and feel. I think this industry could eventually be a terrific place to invest down the road if the pure plays start coming public or get acquired by publicly traded companies. But that will only be the case if the regulators don't strangle this business in the cradle.
So, Jeffrey, did the Cigalite form factor play a role in, say, the downfall of the company?
I think it did, in the sense that we were too slow to pivot away from it. We really believed in it, probably for a year or so longer than we should have stayed committed to it. Hindsight is always 20/20. But we did finally get into flavors. We did finally get into both open system and closed system vaping with tank style products. But by the time we did it, it was a little bit too little, too late. And so we burned through a lot of investor money, and really had dug for ourselves an incredibly deep hole. And the bankruptcy filing was the only alternative that the company had in the summer of 2016. And so we filed, I believe, in September. I was interim president through that period, and basically that ran until I was president, I believe, starting in July. We filed in September. And the new company emerged from the bankruptcy process, essentially from a purchase of the assets of the original company as a going concern. That happened in February of 2017. And at that point, I went back to being general counsel.
So over then the couple of years after that, Altria ended up buying the company. Walk us through that.
So basically, Altria had, of course, very infamously invested a great deal of money in Juul back in 2018. Juul's challenges, problems are, at this point quite well known, subject of two major books, podcasts, documentaries, and so on. And so, over a 5 or so year period, that Juul investment proved to be, or the Altria investment in Juul proved to be very unsuccessful. The valuations plummeted. But I think Altria has always been committed to this category. I do think they're serious about wanting to position themselves for a transformed marketplace and to play a positive role in that transformation. So it was not, I think, ultimately surprising that they eventually concluded that their Juul investment was not going to bear fruit in the way that they had hoped. But wanting to be in the category and wanting to have products that actually are authorized, I think the NJOY purchase, made sense from that point of view.
And you didn't stay with the company?
I did not. And it was not in any way out of protest of the acquisition. I think rather for me, having lived through these issues for the number of years that I have, having seen the ups and the downs and the twists and the turns, and feeling quite passionately that this is extraordinary technology that has incredible potential to save untold numbers of lives. There was a documentary a few years ago, 1 Billion Lives, arguing that essentially this could save, that number of lives if you look at the projection of people worldwide who are projected to die in the 21st century from smoking-related diseases if present trends continue. So I think the stakes could not be higher. And if I've learned nothing else in the years that I've been involved in the policy issues here, it's that for a person who has worked for any amount of time for a company or a subsidiary of a company that also sells cigarettes, they are, essentially forever labeled. And that will forever limit their ability to engage on the issues, to get published, to speak at conferences. What we certainly are seeing with Juul, even though Altria has divested its interests, they are still treated in a lot of different places, for example, by SR&T as, still essentially carrying that taint of having been affiliated with a cigarette company. So I think for me personally, my desire to be able to continue to speak and to, hopefully have a real voice and to potentially have some impact, led me to the conclusion that the only way I could have a possibility of doing that would be if I declined continued employment with the company.
That's a pretty tough decision to have to make, but understandable in this environment. So working then, for a major, vaping technology company is not as bad. Like you still could potentially have a voice. But, Juul's been canceled pretty much.
Yeah. I think they're the, in many ways that kind of the test case of, or the maybe exhibit A of how those, that taint can, once you get it, you can't really get rid of it. And so, so I think from my point of view, it just is more important because I think the stakes are so high in terms of the public health potential of this technology. I do feel a great sense of satisfaction and pride in having played some small part in this story, and having been part of kind of the glory days of NJOY when we, I think, really helped put this technology on the map and in the public consciousness. Of course, others in many ways picked up the baton and took the technology to better levels, to higher levels, which was great. And we did eventually, in my view, catch up to that. But yeah, I think when we look back 10, 15 years from now, this will have been a heroic struggle with tremendous results. And I want to, play a constructive role, even if it's not a paid role. If I can continue to speak and have, some influence on things, I think to me, that's worth a lot.
How much is the regulator susceptible to participating in that cancel culture kind of perspective?
I think, well, it's interesting. I mean, I think if you look at the statute itself, certainly the contemplation when the Tobacco Control Act was passed in 2009, and if you look at the deeming rule itself, there's nothing in any of those documents that says if you're a company that sells cigarettes or if you're a subsidiary company that sells cigarettes, you can't file a PMTA, or you can file one, but you can't do any of the science to support your application. You have to find other people to do it, but you can't pay them because then it's tainted and you have to just hope that somebody out of the goodness of their heart is going to do the science for you. Like, that's not how it works. The cigarette companies are not disqualified from participation. To the contrary, when the statute was passed, it was always assumed that they would be the ones innovating, that they would be the ones making their products safer. If you look at, Matt Myers testified about the statute in support of the statute, and it was a statute that he fought for I think over a decade. He testified about how this is how isn't it crazy that these cigarette products are so dangerous? In every other consumer area, we see products made safer over time. Well, this statute is going to allow us to have that in the cigarette area. We're going to make products safer. We're going to have FDA on the job. They'll be developing product standards. Companies will come out with safer products and so forth. That was always the contemplation. And so I think in many ways it's anomalous that outside of this particular legal framework and regulatory framework, in the larger policy conversation, there is this concept that, well, if you have a connection to cigarettes, you can't talk, you can't participate, you don't have an opinion. And I think when you learn about the history of the tobacco wars, and there's no denying that horrible things happened in terms of misinformation and disinformation by the cigarette companies about addictiveness, about the harms of smoking, about the links between smoking and lung cancer in particular, which went on for years and years and years. But I think to me, when I look at that history, one of the big takeaways is that there can be no compromise on the need to be truthful to adults who smoke. If you lie to them, if you deceive them, they are prone, they are liable, they're at risk of making decisions that are going to be harmful to their health. And so when a cigarette company told a smoker, this is not a dangerous product, this product doesn't cause cancer, a smoker could say, well, in that case, I'll keep using it because I like using it. And I would argue that when tobacco control groups, as they've been doing for more than a decade, are telling adults who smoke these products are dangerous, they may be more dangerous than smoking a cigarette. Well, they make it very easy for a cigarette smoker to say, well, I don't like smoking, I wish I could stop, but this isn't a good alternative for me. It's not any safer. And I think that's a terrible problem. And so I think that it's understandable and appropriate that we always want to keep in mind the sort of the big tobacco sins of the 20th century. We need to learn from history. But I also think that we need to have a similar harsh view of people who lie today. And if anything, in some ways, a harsher view, because they should know better.
Jeffrey, in the US, the vaping market is expected to be $12 billion in sales in 2024. I mean, it's a Goliath. It's big. And, a lot of that, not all of it, but some of it are definitely supported by American store shops and entrepreneurs and employees and vape juice manufacturers and American distributors and so forth. I mean, billions of dollars worth of that is definitely going to a legal, thriving marketplace and infrastructure, which that appears to be what's going to get destroyed.
Yeah, I mean, I think part of the reason why you've seen the cigarette companies emerge as the dominant players is if you're really committed to this category, you are going to need to have a lot of patience, and you're going to need to have a lot of money that's coming from sources other than your sales of these products, because there's no predictability about FDA's review practices. You can't be certain, what quantum of evidence will satisfy FDA. You can't be certain how quickly they will conduct their reviews. You can't be certain that the place is going to be restricted to companies who are also participating in that system. And so, when you put all of that together, that adds up to chaos, and it adds up to we're looking at, it's going to take a number of years to sort all of this out. So I do think it'll be sorted over time, but for, truly independent companies to sustain throughout what could be another 2 years, 5 years, 10 years, it's not a very easy thing to do if it's even possible.
Jeffrey, everything boils down to appropriate for the protection of public health. Has the FDA clearly delineated what that standard is? I mean, everyone says it's about protecting kids, protecting another generation from becoming addicted to nicotine. But is it possible to do that while still providing adults access to nicotine vaping products?
I definitely think it's possible to do both things. I think it's possible. I think Cliff Douglas used the, it's possible to walk and chew gum at the same time, and I think we know how to do it. If you look at, again, let's learn from the tobacco control history, the cigarette industry history from the 20th century. I think over time, what people realized was if you don't want kids to smoke cigarettes, one of the most important things you can do is target the marketing. So we got rid of product placements in movies and TV shows. We got rid of billboards. We got rid of sports sponsorships. We got rid of concert sponsorships. We got rid of putting, cigarette product names on merchandise that isn't the cigarette itself. We got cigarette commercials off of television. That was the tobacco control story for decades. And those interventions worked over time. They worked tremendously well. And also there was truth telling to smokers about the harm profile of continuing to use a cigarette. And those things, being truthful about the science to smokers and targeting marketing that was, that had the effect potentially of creating more youth cigarette smokers, that was the formula for stopping youth or for limiting, restricting, reducing youth usage. I think the same things are true potentially today. I think FDA should be relying primarily on marketing restrictions, and FDA actually goes to, I think, significant lengths to point that out in these recent NJOY menthol marketing authorizations, that they are placing weight on these marketing restrictions that these products will be subjected to. I think that's the way that you keep them out of the hands of youth while also allowing them to be sold responsibly to the adults who can benefit from them. And I think that's the sweet spot. I think we need to find a way to allow them to be sold to adults. We need to find a way to restrict marketing that we know is problematic. And again, we know it from decades of experience with the cigarette. I don't actually think at the end of the day it's all that complicated. And in terms of what does APPH mean at a high level, I don't think it's all that vague either. I think we know that it means that you need to have good evidence that this is going to actually help smokers switch. And you can show that, through a longitudinal cohort study, through a randomized clinical trial. You could show it through, pharmacokinetic testing that shows how effectively you deliver nicotine as compared to other products in the marketplace. And then with respect to youth, you can have similar data like the longitudinal cohort study data. It can also show that kids aren't using the products, but having robust marketing restrictions, I think that's a key piece of the puzzle. So at a high level, we know that you have to have good evidence that you're going to help adults. You have to have good evidence that you're not going to harm children. And then there needs to be continuous monitoring of this stuff. And if the equation, over time stops to be, is no longer being satisfied, FDA can pull the authorization. And that's how the system's supposed to work. And I think it can work, but of course, to this point, it's not working.
Last month, FDA Commissioner Robert Califf, appeared at a congressional hearing, and he made quite a few statements that we've shown to our viewers numerously. So I'm not going to put them through that again for this, but essentially two major things. One, when it comes to appropriate for the protection of public health, he pretty much made it clear that that's about if it's at all enticing to kids, to teens, right? That, well, then it's not going to get approved, because that is really the benchmark. And I've never seen that written down anywhere.
Yeah, no, I think you've put your finger on it in many ways. I think if the test is, and I don't think it should be under the statute or under the deeming rule, but if the test is, if there is any characteristic of the product that could be appealing to a child, it shouldn't be authorized. If that's the test, then you're really not going to have anything compelling authorized. Rather, the test should be looking at all of the circumstances and really placing a lot of reliance on robust marketing restrictions. Because at the end of the day, I challenge any adult who argues, as we see all the time in this space, politicians, tobacco control folks, adults don't need flavors. I challenge any adult who says that to, go home, look in their refrigerator, look in their cupboards, look at what they order when they eat out at a restaurant. I think adults like flavor in basically everything that we consume, even our health foods, even our edible medicines. We want them to be flavored in a satisfying way. And so I think clearly the research has told us time and again that flavors are a huge part of the puzzle here. They are really essential to satisfying an adult who smokes, moving them farther away from their combustion smoking experience. And by the way, we see it with nicotine gums. Nicotine gums do not come in tobacco or menthol flavor. They come in fruit chill, cinnamon surge, and mint flavor. And so, and that's because there's good research out there that sweeter flavors help adults who are trying to quit smoking. So I think if the focus is on product attributes and not on the bigger picture of how do we help adults switch and how do we, prevent marketing that could be problematic, I think that I think that's how we get there.
A superior flavor experience is really key, isn't it?
Yeah, I think one of the things that we learned early on was that I think so much of the tobacco control approach to quitting has been a basically a negative approach, a criticizing approach, criticizing smokers for smoking, harping on the negative consequences of smoking, the damage that they're doing to their health, to the people who are inhaling the smoke that they are breathing out or that's coming out of the lid end of their cigarette sitting in an ashtray. It has been a criticizing negative approach. And of course, I think we all know in the real world, relentless criticism at some point becomes unproductive, if not counterproductive. And so I think what has been fundamental to e-cigarettes, vaping from the beginning has been, let's give adults a positive alternative. Rather than yelling at them, rather than criticizing them, rather than shaming them, let's give them something that they would actually prefer to use, that they will get more enjoyment out of, more satisfaction out of, such that they will not want to go back to their combustion cigarette. And I think clearly flavors are a huge piece of that.
Jeffrey, negativity, I mean, that's really coming from tobacco control and, more importantly, the anti-vaping advocacy groups, which seem hell-bent on destroying vaping. They're calling for flavor bans. You wrote a great paper on regulatory capture. I'd like to turn to that right now for a second, because I know that almost everyone, when they hear regulatory capture, they think of big business, oil, pharma, what have you, capturing the regulator. But you argue in this paper that special interest groups like Bloomberg Philanthropies, Campaign for Tobacco-Free Kids, Truth Initiative, that the special interest groups can capture the regulator as well. Explain that for us.
I think what we've seen over the years with tobacco control, if you go back 50s, 60s, the cigarette companies had enormous political power on Capitol Hill. They had senators and representatives that they could count on to defend their interests, to prevent bills that they didn't like from becoming law. And I think over time, the 70s moved into the 80s, into the 90s, sort of culminating in that famous, infamous hearing when Ron Wyden asked the tobacco executives exactly whether nicotine was addictive. I think the tide really turned, and I think tobacco control groups became powerful, increasingly well-funded, increasingly influential. I think have networked themselves quite well with politicians of both parties. And they have acquired for themselves an incredibly powerful voice. And it's a voice that FDA and CTP take very seriously and listen to very carefully. And I think we've seen it in example after example. I think one of the most interesting examples, and it's one that often isn't talked about, is when we won the Satera case back in 2011, my expectation was FDA is going to issue a deeming rule any month now. just a clean, straightforward deeming rule that e-cigarettes are now under our jurisdiction. And it was astonishing to us that we didn't see a proposed rule come out until 2014 and a final rule another 2 years later until 2016. And what we later learned, and this is, I think Jamie Ducharme writes about this in her book about Juul, was that rather than doing a clean, simple, straightforward deeming rule on e-cigarettes, FDA decided to put cigars into it, and not just any cigars, but they also decided to include premium cigars, even though there's no evidence that kids use premium cigars. But they were getting pressure from tobacco control groups. You can't leave anything out because these cigarette companies are so devious that they'll find a way to exploit that loophole. And so the deliberations over that took them from 2011 to 2014, and then, the additional 2 years of delay. They could have done a clean rule so much faster, and it really was beyond ridiculous. I think FDA always knew better. One of the things that Scott Gottlieb talked about when he announced his 2017 comprehensive plan, we really do need to take a fresh look at this premium cigar issue and whether we really want to be spending our resources on that. And of course, ultimately, the court took that decision away from FDA and struck down its inclusion of the premium cigars in the deeming rule. But that was a lot of wasted resources, a lot of wasted time, and I think tobacco control really bears responsibility for that. And it's certainly not the only example, but I think it's a particularly notable one because I think candidly it was just so foolish.
So are these special interest advocacy groups, Campaign for Tobacco Free for Kids, Truth Initiative, Bloomberg Philanthropies, are they tobacco control?
Yeah, I think historically they certainly were. I think historically, the Truth Initiative was created out of the Master Settlement Agreement to be the truth teller. It wasn't originally their name, it was the Legacy Foundation, but really to educate about the harms of smoking and to really try to prevent more kids from taking up cigarette smoking. But you look at Campaign, you look at the Cancer Society, Lung Association, Heart Association. They were the backbone of tobacco control. They fought the good fight against combustion cigarettes and ultimately prevailed and did some wonderful things and really contributed in a positive way in the 20th century to public health. But I think one thing I've seen in this space, or one thing that I've not seen in this space, is I've never heard of an advocacy group in this space announce that these are our goals, these are the milestones we are looking to achieve. When we get there, we will shut our doors and we'll move on and use our great minds and our resources to solve some other significant public health problem. They are in it for as long as I think they can be in it. And so that may require, just like in the business world, you may have to sometimes change your product mix. You may have to sometimes change your focus if you want to stay in business, if you want to stay relevant. And so I think what we've seen is while these entities were true tobacco control in the sense of cigarette control, that they were fighting the good fight against cigarette companies in the last century, now they are fighting against all nicotine products, and particularly with particular force, they are fighting against e-cigarette products. And that has become, I think, enemy number one. I mean, it's notable that a lot of these groups are promoting outright e-cigarette prohibition in any country where they can get something like that passed. And of course, there's not a country in the world that bans the sale of cigarettes. There had been one, and they reversed their ban within the last year or so, I believe.
In part one of our conversation with regard to FDA's authorization of NJOY's menthol flavored products, you mentioned that these tobacco control groups demonstrated some very vicious statements and actions towards the FDA. Why don't we pull the conversation back to that again and describe what happened there in your mind?
Yeah, I think, and by the way, I want to be careful about one thing. To my knowledge, one group did not release a statement that was negative. They didn't release, I don't think they released a statement at all, but they did not criticize FDA, and that's the Truth Initiative, which is under new leadership. And so I'm cautiously optimistic that that is a hopeful sign that that they will chart a more independent course that will be that will be more respectful of FDA and its basically the integrity of its decision making. And I don't think it's an accident that a former top FDA official is now leading the Truth Initiative. And so I think that's a hopeful sign. But I think we saw words like shameful, deeply troubling, horrible, harms the public health. I mean, really, really aggressive, I think outright nasty language of a type that I think responsible groups that consider themselves to be guardians of the public health would refrain from ever using when talking about the Food and Drug Administration. And when you're talking about an authorization of 4 products that have been under review for 4 years, and that clearly are not part of any youth usage that has been measured or detected by anybody acting in good faith, it's preposterous. And I think it's uncalled for. I think it's irresponsible. And I think it's unfortunate. I think that's one of the things that is going to have to change. And I think over time it will change, but I just don't know how much longer that's going to take. And who knows, maybe the Truth Initiative will really emerge as a leader in bringing groups back to a position of greater balance. And I think Truth Initiative is not in any way taking its foot off of the pedal of trying to protect kids and trying to be very, very focused on how best to do that. But I think they are now starting to take a broader view of, taking into account how do we help adults. And I think that's a significant development and hopefully something of a breakthrough.
Yeah, I appreciate what you're saying, Jeffrey, about Truth Initiative. I mean, they had the Schroeder Institute, and, plenty of great scientists used to work there. Dr. David Abrams, Dr. Rainiera, have all been on our show. And I was always like, maybe that's from a time in the past, because Truth, for many years has seemed to participate very strongly with the other ants. Is how people in our side of the industry.
I think in the past they've had a great record. Cheryl Hilton headed the organization and did some wonderful, wonderful things. Tom Miller was the chairman of the board there. And to your, as you noted, David Abrams and Ray Nara both worked there. So I think Truth has in the past been a more science-driven voice, and I think it's coming back to that. I'm cautiously optimistic, which I think will be great.
So Kathy Crosby is the new CEO and president of the Truth Initiative, which is the nation's, as they call it, the nation's largest nonprofit public health organization dedicated to achieving a culture where all young people reject smoking, vaping, and nicotine, and a future where commercial tobacco and nicotine addiction are a thing of the past. And that's current. That's under Kathy's bio. Seems to me, though, that's the problem, is that they're of a mind that they can force youth to reject these products, and that they can somehow prevent or stop commercial nicotine addiction.
I think that we will best be able to assess how they are impacting on the conversation by their actions when things like these NJOY authorizations happen. And I think the fact that they didn't, in a reflexive way, issue a negative statement and I would argue an irresponsible statement, I think that was significant. I think recently Amanda Graham of Truth, who's a very serious and very thoughtful scientist, I think put out a blog post and talked about the potential benefit to adults who smoke and have been unable to quit with medicinal products to use an authorized e-cigarette product. That is, that is in this world, in this tobacco control world in the United States, that is a revolutionary statement. And I think it's, again, I think it's a helpful step forward toward staking out a position that is independent and that is science-driven. And so, we'll see over time. I think with a lot of this stuff, it can be hard to judge based on a snapshot in time, but hopefully we'll see more of those kinds of statements from Truth. But I think Kathy, I think Amanda, I think they are serious professionals I think they're balanced. I think they're thoughtful, and hopefully we'll see more good things from them.
Jeffrey, this is a sensitive question in the sense that do you believe that some of these nonprofit tobacco control groups, Truth Initiative aside, are they guilty of bullying the regulator and maybe even politicians?
Yeah, I think very much so. I don't think that they've been very subtle about it. I think, if you go back and watch that June 2021 hearing where, Janet Woodcock is up there and Senator Durbin is allowed to give opening remarks, and he says, this is the Super Bowl, and I don't think they're up for the challenge. And you had Representative Krishnamurthy, basically saying, will you commit to denying all flavors, including menthol? And Katie Porter from California, more or less exactly the same words. Will you commit to denying all flavors other than tobacco flavor? I think that kind of approach is so shocking and outrageous. And again, I think in a true medicinal context, we would recognize it as such. And I think in the COVID context, I think people kind of saw some of that on display and were horrified by it. And I think there should be the same kind of rejection of those sorts of tactics here. I think the only thing that we should be demanding of FDA is that they do their job well, that they follow the science, they follow the statute, that they keep in mind kind of the stakes here, that according to the CDC, 500,000 adults are dying prematurely every year from smoking-related disease. Those are higher than COVID numbers, even in the worst years of COVID. So this is a truly significant public health problem, and it requires seriousness. It requires scientific independence, integrity, and it requires an ability to stand up to politicians and advocacy groups that would try to trample on the agency's exercise of its prerogatives.
Back in 2012, 2013, did Americans in the same quantity believe that vaping is as harmful or more harmful than smoking as they do today?
No, I think it was quite the reverse. I think in the 2012-13 timeframe, I think roughly half, maybe even a little more than half of adults had an accurate picture that it was either simply safer or much safer than smoking a cigarette. I think now, it might be fewer than 10% have that perspective, that it's safer and possibly much safer than smoking a cigarette. One of the big disinformation campaigns was that vaping, put you at higher risk of COVID. Vaping, nicotine is responsible for EVALI. I mean, those were the two biggest examples of true disinformation that really extraordinarily pushed the numbers further down. And the American Cancer Society actually itself did do a study that showed that, I think from 2019 to 2022, and tied it specifically to COVID and EVALI, that the perceptions became much, much worse. And that there was a straight correlation between, in other words, and it makes sense. People who thought that vaping was more dangerous were less likely to switch to vaping than people who thought it was less dangerous. It's not rocket science, but we actually have real data that shows that in fact that's the case. How are you going to get significant switching with those kinds of numbers? And I think because FDA and tobacco control has basically, almost kept it secret that we actually have some authorized products. I think there's no ability on the part of anyone in the public even to be aware that there are actually some products that have been through an exhaustive FDA review, and that has some meaning. And I think that's unfortunate. I think that's incredibly unfortunate, because the contemplation historically always was people need to know the truth. And they need to know about relative risk. And, I think that too will be a measure of when tobacco control groups are beginning to act more responsibly, when they actually fully acknowledge the import of FDA authorization decisions. and don't try to pretend that, well, FDA just gave them a right to be in the market. No, FDA made a finding that this product the marketing of this product is appropriate for the protection of public health because the science indicates that it reduces risk to the person who either switches completely or displaces most of their cigarettes with the product. That's a weighty, significant thing. And tobacco control groups, first among everybody, if they're serious and responsible, ought to be promoting that message. One of the things that has really bothered me about tobacco control, and I think we've talked a bunch about it today, is just the incredibly disparaging, disrespectful way in which they talk about FDA and its leadership. I think that's totally irresponsible in the world in which we live in, and I do think that FDA should be spoken to differently. I think it should be treated with greater respect, which can be hard to do if you disagree with its decisions. And again, and these are life and death issues, they have not handled it well, and I think there's no ifs, ands, or buts about it. I think Dr. Califf recognized it when he reached out to Reagan Udall to do a review of the center, because he realized this was a center that was not performing the way that it was supposed to perform. And I think that the review itself found that there are a lot of deficiencies here and a lot of things that CTP needs to correct, and I don't believe they've corrected them yet. But all of that is not to say that FDA is some kind of rogue organization, or the people who run it are unsavory characters who are doing horrible things, who don't care about human beings. I think we have to be very, very careful and responsible about how we engage in these issues, because I think that public confidence in our institutions in our true institutions of public health is important. And it doesn't mean that we can't criticize them, but I think we always need to do it with a strong dose of respect, and we need to try to do it in a constructive way rather than a destructive way.
They are quick to praise the regulator when the regulator's doing exactly what they want. The second that the regulator moves even just an inch, they are all, oh, this is troubling. This is disappointing. This is,
I think it's even worse than that, because I think that, the premium cigar issue, and I think the haranguing of Dr. Woodcock, which led to a reversal of the prioritization plan, and which led to those wholesale denials of the smaller players. I think those were things that tobacco control put into effect. And yet, tobacco control was the first to criticize FDA, for example, for not getting to the Juul applications much sooner. But they caused that to happen because they caused FDA to shift focus. And so I think that, I think it's an example of them truly behaving like advocacy groups that are just trying to be consistent in advocating for things and being aggressive and having press releases and being seen to be tough and strong and aggressive. But I think if you're really taking a holistic view of the situation and you really are trying to contribute to the public health, you have to step back and really think through the consequences of your actions, or the potential consequences of them, and really try to do things in a way that's going to ultimately truly serve the public health in a meaningful way, and not just, get for you some type of short-term victory that you can tout in a press release.
Are they causing harm, like real harm? Like, do they have blood on their hands?
I think they do. I mean, if you look at the toll of, look at the CDC numbers on the number of Americans who die from smoking-related causes every year prematurely, and look at the data on how quickly a former smoker can recover, much of their health by quitting within, just a few years, depending on their age. They can recover a great deal, and they can eliminate a lot of their excess risk from having been smokers, even, having been smokers of 10, 15, 20 years duration. And so, I think a disinformation campaign that has been ongoing now for more than 10 years, I don't think you have to be a math genius to realize that a lot of people potentially could have been saved from premature deaths if we had been truthful with them about, ways in which they could have stopped smoking if medicinal interventions had failed them.